Hello, my name is Richard Jutkiewicz. Today I'd like to discuss narrative medicine as a framework for humanities, education, and medical school. 10:12 a.m. exactly. Marissa, this is Dr. Mills. There is an abnormality. My world came to an end. While this is one frame from a graphic medicine novel, Cancer Vixen, by Marissa Marchetto, I think it represents the power of the medium. I think we could all relate to those words and to waiting for a phone call from a doctor's office or a doctor giving us the results of a test or information we might not want to hear. We're going to discuss the theoretical framework of graphic narrative medicine, the origins, why is it important in medical education training, along with some examples of where it might be making a place today. So studies show that empathy levels are declining during medical training. Reasons are loss of idealism, heavy workload, poor social support, conflicting professional personal responsibilities, and that resident burnout is rising, as is depression. In the study from Sutherland et al. 2021, they used the qualitative design study to aim to answer what factors contribute to burnout and would an empathy training curriculum delivered with graphic novels affect empathy-based practice. The conclusions were residents appreciated sharing difficult experiences and seeking support. They acknowledged the curriculum as a commitment to wellness and felt it reduced burnout and improved empathy. The comics were viewed as an effective reminder of the patient perspective. So there are two key points: a commitment to wellness and an effective reminder of the patient perspective. So the use of graphic novels and narrative medicine in medical school training can help students treat themselves as well as treat their patients. And I think that's why it's so important that we study it further. So the framework requires necessary training and skills involving close reading, attentive listening, reflective writing, and authentic discourse with patients and medical students. You may be asking yourself, what is close reading? Well, it involves critically reading, absorbing the written word, and interpreting what you notice. One must relate to what you are reading and interpret the script into a cohesive argument. As an example, in a workshop, a moderator or a professor in a classroom might lead with the phrase, "What am I always listening for?" and have the audience finish the statement in their own words. These can be written on a 3x5 card. They can be shared with partners and read aloud and discussed. As an example, what am I listening for? I might write, "When I approach my front door, I'm listening for the sound of moving feet across the wooden floor, a shriek or chirp due to the excitement of seeing one another again, the rushing to greet me whether I've been gone for 5 or 50 minutes. Even though it's been 3 years, I miss my golden retriever Guinness, who crossed the Rainbow Bridge in 2021. So using that as an example, we would really start at the beginning and spend a lot of time on every word, trying to realize what the author was feeling when he wrote it. This can be open for discussion and interpreted in many different ways, but by slowing down and taking each word as its own self, it can lead to discussions that teach us more about why it's so important to be empathetic, caring. So at Rutgers Health, first and second year medical students must embrace a 3H curriculum involving healing, humanism, and health equity. For the purpose of my research with graphic medicine, I'll be delving into humanism, where I believe empathy resides next to kindness, compassion, humility, and curiosity to each patient. I believe it's important to point out the importance and recognition that we just can't study the science. In Dr. Sharon's writing and studies, the science within the frontline facing community must have the humanism aspect as well. So, who's doing the work and where is it being held? Well, I found recently Harvard Medical. Harvard Medical School hired a librarian, Matthew No, specifically for his work in graphic medicine. And while he has other duties, it is important enough to warrant his attention and Harvard's as well. I've included the website if you'd like to read more. In this photo, he's standing in front of a traveling exhibit that the National Institute of Health recently sent to the George Smith Library where I work myself. And it was through this exhibit that my interest was piqued, and I thought it might be a great example to use for my own research. Again, only to find out that Harvard Medical had a history with graphic medicine and narrative medicine, as well as across the river at Columbia University. I've included the website for Columbia University's Department of Medical Humanities and Ethics, led by none other than Dr. Rita Sharon, who I mentioned recently, and an interesting staff with training from both medical fields, arts, and humanities. They also offer one of the first master's programs in graphic narrative medicine. Well, of course, who doesn't like a great TED Talk? The next two slides introduce you to one, Fulbright scholar Dana Walrath and her personal story of comics, medicine, and memory as she became caretaker for her mother going through dementia. And two, comics creator Sam Hester discusses how visual storytelling creates better health care. These are just a couple of examples of the growing body of work that's encompassing graphic and narrative medicine. Again, the field started to gain some recent traction in 2000, so it's relatively new. There's a lot of work to be done, and I look forward to continuing research and teaching medical students how to use graphic novels and graphic medicine to be more empathetic and to create a humanistic environment where they're listening and caring for patients as opposed to just treating them. So thank you very much for your time. I look forward to any questions you might have. Also attached are the references I've used for this presentation. Good night.